Welcome to the Point, presented by SSM Health Monroe Clinic Medical Group. I'm Kent McConnell, and we are together today with Dr. Darren Pipp, Chief Medical Officer of SSM Health Monroe Hospital and Monroe Clinic Medical Group. Doctor, welcome.
Good morning, Kent. Thanks for having me.
Well, we'd like to thank you for joining us. And today we'd like to be talking about the strain that many healthcare facilities are going through, including SSM Health in Monroe. And how about maybe cluing us in a little bit more about the stress some of these facilities are experiencing?
Yeah, certainly, Kent. Well, SSM Monroe Hospital and Monroe Medical Group is certainly, like many other healthcare organizations in the U.S., experiencing very high patient volumes right now. And these volumes, are certainly adding to hospitalized patients. Many of these hospitalized patients are COVID patients. So we have this going on kind of on top of staffing shortages. So there's a lot of strain on us and a lot of strain on many hospitals in the U.S. and in Wisconsin. I mean, that's pretty common this time of year anyways. This is getting to be flu season. People get together for the holidays and we spread illness, but it's exceptionally busy this year as compared to many years. And then there's other factors. Some of these patients that we have now with COVID have very extended hospital stays, so that is certainly affecting the number of beds that we have, and skilled nursing facilities where we often discharge patients are also experiencing bed shortages and staff shortages, so that it all creates a little bit of a traffic jam of sorts.
Would you say that the extended hospital stay is more of a factor now than it was initially when this first broke out?
Yeah, it certainly seems to be. I mean, the patients that are hospitalized with COVID are often in the hospital for quite a long time, and our numbers are certainly much higher now than they were early in the pandemic. So,
how would you say you're adapting your processes to handle this strain?
Well, so, one of the things that you may recently have seen in the media is we made a difficult decision and we suspended certain non-urgent surgical procedures, and these would be surgical procedures that, may need a hospital stay afterwards. So we had to kind of take those offline to try to open up some more hospital beds for these acute care needs. And we're not canceling the surgeries. Of course, we're just rescheduling them. But we have so many ill patients that the beds are needed, and the staff that help with these surgeries are also needed for acute care needs.
How can we in our communities contribute to reducing this strain?
Just, we are all very fatigued with COVID, but we have got to stay diligent for a while longer. I mean, we need to wear masks. We need to continue with some social distancing. If you're not vaccinated, that certainly makes a difference. We would encourage vaccination, and I'd say, be patient with us in healthcare facilities. If you come in to be a patient, provide our staff a little grace. I mean, they're busy and really overworked right now.
Booster vaccinations, I guess I should say, are being recommended right now. But how about initial vaccinations? Can community members still get their initial vaccination?
Oh, absolutely. Initial vaccines and boosters are available Monday through Friday, like 8 to 4 here. People can schedule through MyChart. They can also call 608-324-1815 to get scheduled. We would love to get more people vaccinated.
We're visiting today with Dr. Darren Pipp, Chief Medical Officer of SSM Health Monroe Hospital and Monroe Clinic Medical Group. And Doctor, as our families gather for the holidays, what are some ways that we can celebrate safely?
Yeah, well, of course, we want to be able to get together with our families. I think it's just a matter of, thinking about how large gatherings that you go to. I mean, if you can keep it to smaller groups, that would be better. If there are some unvaccinated folks, you might really want to consider masking up. It's just not worth the risk. And certainly, we've definitely learned this in the past year or two now. If you are not feeling well, you owe it to everyone else, I think, to just stay home and allow the rest to have a healthy holiday together.
Now, if some folks want to find out the newest SSM Health COVID-19 related information, what would be the best way of doing so?
Yeah, there's lots of information on our website. It's monroeclinic.org/coronavirus is probably the easiest. But also on Facebook, we have information. So either place you could find info. Our marketing folks are good at keeping things up to date.
Anything else that you'd like to be able to put out there coming from SSM Health Monroe Hospital or the clinic group?
A big thanks to our staff, honestly. I mean, they have been working tirelessly for, almost 2 years now. I think we've been in this. Lots of overtime, lots of extra shifts. I mean, they are really digging in to try and do everything they can to keep our community healthy. So I'm very proud of them, very appreciative. And then just a wish for everyone out there to have a happy and healthy holiday season.
For Dr. Darren Pipp, Chief Medical Officer, I'm Kent McConnell, and this has been To the Point, presented by SSM Health Monroe Clinic Medical Group.